The following is a presentation on mental health parity in Oregon. It is presented by Frontier Nursing University Willow Group in PC 729. The views or opinions expressed in this presentation are solely those of Mindy Leroy, Andrew Thompson, and Paul Volsdorf, and do not necessarily reflect the views or opinions of Frontier Nursing University. Please listen to our presentation and approve Chapter 705 of Oregon State Law that deals with mental health parity. Parity, as it relates to mental health and substance abuse, prohibits insurers or healthcare service plans from discriminating between coverage offered for mental illness, substance abuse, and other physical disorders. Parity requires insurers to provide the same level of benefits. These benefits include visit limits, deductible, and co-payments. Mental health can affect our emotional, psychological, and social well-being. It affects how we think, feel, and act. Mental health is important at every stage of life, from childhood and adolescence through adulthood. There is a wide range of mental health disorders. According to the CDC and the American Psychiatric Association, there are more than 200 types of mental health disorders. Some of the common disorders are depression, mood disorders, anxiety, and substance abuse disorders. According to Mental Health America, in 2018, 1 in 5 adults, or 18%, that is, over 43 million Americans, have a mental health condition. And sadly, approximately 9.6 million experience suicidal ideation. Mental health disorders are real, and most Americans with these disorders lack access to mental health care. In 2018, 56% of Americans with mental health disorder did not receive the treatment, and 7.7% of youths had no access to mental health services through their private insurance plan. As this map illustrates, mental health is prevalent throughout the US, and Oregon has the worst ranking. According to Oregon Health Authority, mental health is prevalent as 1 in 5 adults suffers from a mental illness. Suicide is higher than the national rate for over 30 years. And in 2015, 762 people committed suicide. These people are crying out for our help. We need to find a way to help them. It is not surprising with the opioid crisis in the US that Oregon deaths from opiate overdose increased from 73 deaths in 2000 to 332 deaths in 2011. And in 2016, over 1,800 Oregonians died from alcohol-related causes. We need to protect our citizens with mental health conditions by improving access to mental health care. In 2016, an evaluation was conducted, and there was significant provider-to-patient disparity, where there was over 5,600 patients to one mental health provider. This is unacceptable. This legislation will increase access to mental health care for Oregonians. As this map illustrates, that due to the lack of access to mental health care services in Oregon, patients have to go out of network to see a mental health provider. And insurance won't always cover the cost, so the patients are stuck with the bills. By approving this legislation, it will increase access to mental health care, which studies have shown will improve outcomes. It will increase substance abuse treatment reimbursement rates and increase the utilization of mental health services statewide. And it will also decrease the out-of-pocket cost for the insured. This legislation could also prevent tragedies like what happened to Troy Vincent, a 46-year-old male from Lowell, Oregon, with a history of substance abuse and brain injuries, who in 2007 attempted suicide and homicide by using an air-compressed nail gun to shoot 3-inch nails into the back of a 31-year-old female's head and into his own. Or Ricardo Shaney, a 32-year-old male with a history of mental illness from Eugene, Oregon, who in 2014 went on a shooting rampage that resulted in the death of a 79-year-old retired University of Oregon professor, a deputy, and his suicide. Or Tanya Yacht, a 39-year-old female from Milwaukee, Oregon, with a history of bipolar, who in 2007 committed suicide by shooting. These tragedies, like many others, are listed as preventable with the appropriate mental health care. Time is up with the inequality with mental health care services. People with mental disorders and substance abuse deserve to have non-discrimination health insurance policies. Governor Brown, please approve Chapter 705 of Oregon state law so that we can prevent tragedies similar to Troy, Ricardo, and Tanya. Thank you for considering this important issue.